Good morning, my name is Terica Kelly. I am a first semester nursing student. Today is November the 17th, 2016. It is approximately 12 o'clock in the afternoon, and today I will be performing an insertion and removal of an NG tube. I have my supplies gathered. I will then proceed to go into my patient's room, perform hand hygiene, introduce myself, check my 2 patient identifiers, check my physician's order. I will then assess the patient for their NARS, any past nasal surgeries, their mental status, and level of cooperation. I have a towel here to protect the patient from any gagging during this procedure. I also have a vomit bucket. I have water to help the tube go down when I'm going deeper into this patient's body. And now I will begin my procedure. I have put my patient in a high Fowler's position. And now I will begin by measuring the tubing from the nose to the ear and the ear to the xiphoid process and marking this. I'll proceed by lubricating the tubing. Asking my patient to hyperextend their neck, going into near closest skin. Once I begin to hear gagging or coughing, I will then tell the patient to look down. And now I will begin turning the tube 180 degrees. At the same time, I will ask the patient to take swallows. And while they're doing that, I will go down 2 to 4 inches and switch between the swallowing and the pushing down the tube into their body. Sip, sip, push down. Sip, sip, push down. Okay. I will then temporarily secure my secure my tube to my patient's gown. Now I will check for the placement of the tubing. I can either aspirate the stomach by getting some of the bowel and testing for bilirubin and pH. I will then have to inject the gastric juices back into the stomach. Or I could do an x-ray, or I could take 10 to 30 mils of water and inject it, air, and inject it into the stomach and listen with my stethoscope for any whooshing in the stomach. I hear that the placement is correct. I will now secure the tubing to my patient. Making sure that they can still breathe. I would then ask if they needed anything, check and see if they would like to stay in this position or lay back down. I would prefer them to stay in this position. See if they need their call light, their personal belongings are close to them, then I would go document this procedure. Did it stop?
Okay, I don't know.
It don't matter.